Hi, good morning. This is Dr. Larry Bush again from the Palm Beach County Medical Society. As you know, I'm an infectious disease specialist. So, what we thought we would talk about today is what we know new about COVID or coronavirus 19 and update people who are interested. First of all, this is a pandemic. Let's just define for a moment what a pandemic is. So, diseases, contagious diseases, either could be sporadic events that occur once in a while unexpectedly, or they could be diseases that we call endemic. Endemic means there's always that disease in the community to a certain level, but it hasn't increased. An example would be every year we have flu, seasonal influenza, and that would be endemic. An epidemic is when there's an acute spike or increase in the amount of cases within a certain geographic area. An epidemic can occur if a lot more people become in contact with it suddenly than normally, or there's a new infectious agent that we're not normally immune to. And that leads us to what we have now, a pandemic. A pandemic is when there's a large outbreak of a novel infection, meaning that the human population has not been exposed to it before and therefore has very little or no natural protection. And pandemic means that it's spread across countries and continents and it's global. And as you've heard me say before, we live in a global society. You can get anywhere in the world rapidly. For example, in 2015, 1.2 billion people on the planet Earth traveled internationally, and that number is larger even now. So pandemics have occurred in the past and they're likely to occur again. With this new coronavirus, we know that humans have not been exposed to this one before and therefore we're vulnerable. As far as acquisition, the routes of transmission still appear to be close contact, meaning respiratory spread. Respiratory droplets can get on surfaces, we call those fomites, and they can have the organism stay on them for some period of time. The exact amount's not known. And then if we touch them, we can introduce them into our mouth, or our nose, or our eyes, and it can get into our respiratory tract. So there's person-to-person close contact spread, there's spread on contacts, and there's potentially spread via fecal material. But again, that would involve close contact and contaminating your hands or a surface and getting it into your mouth or nose. So how do we prevent that? Well, the obvious thing that we're hearing over and over and over, the common message, scrub your hands, use as much disinfectant or antiseptic on your hands that you can, scrub the surfaces around you, that's called disinfecting. The only difference between disinfecting and antisepsis is antisepsis are for human tissues and disinfectants are for innate or inanimate articles. After that, it's avoid contact. So we have what's called social distancing, and everybody's waiting for recommendations from the local government or the state or the national government via the CDC. But it's common sense. If you don't need to be in a crowd, don't. All gatherings should be held to a limit if held at all. As you know, there are restrictions going on for restaurants and bars and movie theaters and get-togethers. Schools are closed. And although these may sound over the top or extensive, the only way you can control a pandemic is to stop the infection from coming into your country, and that's been done in this country. Travel, as you know, from China and Europe is no longer allowed. And also to take the people that you have and contain them, to keep them distanced apart. And if you do that, eventually the infection will not infect anybody else. Those who are infected are likely to recover and develop some form of immunity, which we don't know enough about yet, and the pandemic will stop. So let's talk about testing. There was a lot of criticism that testing was not widely available. Well, as of today, as we've heard, testing is going to be rapidly and dispersed evenly throughout the country so that there'll be places that people can go without going to their healthcare provider or to the hospital and have a rapid test for coronavirus, which comes down to who should be tested. Well, testing should be done in people who meet criteria for being ill, and the definition of illness for coronavirus right now is people who have fever, shortness of breath, and cough. Those people, even if they haven't had necessarily exposure to a known corona, have to be screened, because the highest priority are people who've been traveling to an area where coronavirus is going on in a large amount. Secondly, people who've been exposed to somebody who's been diagnosed with coronavirus or is under investigation for possible coronavirus. And thirdly, are the group of people who would wind up in the hospital severely ill with a respiratory infection, although they've had no known exposure, it would be considered. When you take that group and then you bring it down to the people who are most likely to do badly if they do get infected, that brings us to what's defined as elderly and those with underlying conditions such as lung disease, heart disease, kidney disease, diabetes, cancer is under therapy, and certain medications that patients are on to suppress their immune system for other conditions. They too, if they have the symptomatology, should be tested. The last category. How about somebody who's been exposed to somebody who may have coronavirus or somebody who's been defined as having coronavirus but has no symptoms? The problem with testing them is just because they're negative the day you test them, if they're going to develop the disease, they could become positive later. Because what's not known is exactly when does your test become positive? Is it before you develop symptoms, right before, or shortly after? Therefore, we cannot take a lot of confidence that a negative test in an asymptomatic person who has been exposed is necessarily mean they're not infected. That's why anybody who's been exposed, self-quarantines has been recommended. So we'll leave it like that. I'm sure we'll have other updates. I too believe, like the people at the CDC and various health industries believe, that this pandemic will come under control. You have to stop the influx into the country, contain the people who do have exposure or disease, and take care of those who are ill. And if we do that, the hospital surge will not be great. We'll be able to do that. I'm sure there'll be other things. As of today, as you know, there are still not any approved antiviral medications, although many are being looked at, and there's no current vaccine to prevent future spread or future infections. All right, everybody stay well. Thank you.